think we have to go back to the fact that although fewer people smoke than they did, it is still, worldwide, it's as big a source of avoidable harm in the medical world as we have. And so it's a thing we can't be complacent about, and we have to do something. And this is an effective strategy, and I think it's part of our duty as healthcare professionals to highlight things that can reduce harm. And so it's a thing I think we should all put our shoulder to the wheel about.
So we know that cigarettes, which contain nicotine, also contain many thousands of other harmful chemicals and components that cause ill health, cause cancer, and shorten people's lives. The nicotine within cigarettes is addictive, but it's not otherwise harmful to health. But it is the reason why people continue to smoke, because they are dependent on that nicotine. It's a physical addiction. So if we can replace that nicotine in a way that doesn't include all those other harmful chemicals that are in cigarettes, and we can do that through lots of different means, through patches, through fast-acting nicotine replacement therapy products of all different sorts, and through nicotine-containing vapes, then we immediately reduce the harm from smoking, because people are no longer taking in all those harmful chemicals from a traditional cigarette.
So there's quite a lot of misinformation about vaping. So common things I hear are they're just as bad as smoking, that they are a way for the tobacco industry to prolong the use of their products and make money. I still hear things about popcorn lung, which isn't related to vaping at all. I hear things about lung injuries, acute lung injuries, which again isn't related to nicotine vaping. There seem to be the main things, and also fires as well. That we can't really have them in hospital settings because there might be a risk of fires. All of which aren't actually true.
I think what I see very frequently, and it's understandable because across the whole healthcare professional workforce, people have different interests, different skills, they're working in different areas, but we know that there's significant misunderstanding and perhaps a lack of understanding around where these fit in terms of supporting people to stop smoking or to reduce the harm from smoking. Actually, there is an equal amount of misunderstanding across society, people, and the patients that I look after. So the message is now really clear, and we've got national and international evidence to support this. We have NICE guidance, which tells us that nicotine-containing vapes should be offered to people who are tobacco dependent as part of a quit smoking offer. We have a very compelling OHID report that's recently been refreshed that tells us that these are 95% safer than continuing to smoke cigarettes. And we have a Cochrane review that's recently been published and shows us that nicotine-containing vapes are, in fact, one of the most effective means of people quitting. So we have an intervention which is 95% safer than smoking, which is highly effective at helping people quit or reduce the amount that they smoke. And we need to be able to have a sensible patient-centered conversation with people about this. And often I think we need to be more confident about being able to bring it up, because we know that the information and the education around these in society and in our patients is variable, and there are misconceptions there.
I used to run a stop smoking service, and we launched the first vape-friendly stop smoking service in 2014, and we did it without any knowledge of what this would mean, but we were astonished at how popular the idea was of switching from smoking to vaping. People were looking, as smokers do, they were looking for a magic wand, and for many of them this was it. And our success rates really rocketed once we introduced vaping to the armoury of tools that we've got for stopping smoking. Well, we've got a lot more evidence now than we had back in those days. Back in 2014, we've got the OHID review that was published in 2022. OHID used to be Public Health England. We've got the Cochrane review, and we've got NICE, and all confirm that there is strong evidence that a nicotine-containing vape will help people stop smoking. And the important thing is that they switch completely. Some people will use one and then the other and keep swapping backwards and forwards.
All of my colleagues working with patients with service users are enormously busy. And it's easy for someone in a grey suit and a tie to go, look at the evidence, it's very clear. But make time to talk to your fellow professionals who are informed on this subject. Get that evidence in your head. And that will make your job, not just now, but in the future, more rewarding and easier, because you'll see fewer people coming through your doors with those devastating conditions that blighted the start of my career.